And the reason we are here is that the National Fund for the Disabled of Kenya has helped this special hospital to purchase equipment that is essential for the work that they are doing here. The National Fund for the Disabled of Kenya has funded the hospital to purchase equipment that is going to help them not only to cure, but also to rehabilitate children who have, for various reasons, are unable to use their limbs, able to use their bodies, and whichever other movements that they have been lacking. So the fund has acquired equipment worth 5 million. These are special projects. We normally are not able to fund just one project with that amount. It's one of our flagship projects, but it's a special one because the kind of service that goes on here is not replicated anywhere else in the nation. And it's one of our flagship projects, but it's a special one because the kind of service that goes on here is not replicated anywhere else in the nation and beyond. We have recognized, as we have offered service to various children and learners with disabilities, that there's a need for early detection and treatment of some of the ailments that continue to disadvantage our children when they grow up. We find children at school who cannot use their limbs because in the early days they were not able to be exposed to the treatment that we can now find in Kenya. This AIC Cure Hospital is a special facility in Kenya today, and we would like to appeal to parents and would like to appeal to the listeners to know that it exists here and also that it's possible to remedy some of the problems that we find, making it difficult for children to work together with the others in schools, even in the villages, even at family level, because of disadvantages physically, sometimes even mentally, because from here again, they can be referred to other hospitals that also work like AIC Cure Hospital does here at Kijabe. For various treatments, we have been told that Uganda deals with rather neuro physical ailments. We do give some assistance. We support institutions of learning where the children are with disabilities with physiotherapy equipment. We do equip some of the facilities, some of the hospitals, some of the dispensaries at that level, but with not this specialized level, because this also brings together doctors specialized in physiotherapy and beyond. We have also seen them molding limbs and producing flexible limbs like, well, God would have made it. And that is not just easy. You don't find that kind of person everywhere. So for now, with what we have, we are able to supplement work at Kijabe. For the others, we are able to continue the way we have done it, and we do so. And we encourage them also, there's various institutions, to work with us to ensure that children are not totally left out.
Even today is a very special day for us. We are honored and privileged to have the National Fund for the Disabled in Kenya coming to partner with us by supporting us to get this very specialized equipment because this is pediatric equipment. The need is great. Every year we see, for example, last year we saw about 24,000 patients in our outpatient here in Kijabe, and as well as the mobile clinics that we go to at least 27 of our counties. And from those outpatient visits, we are able to have 3,000 children getting surgery every year. We currently have a waiting list of about 1,000 children who still need surgery. And our appeal is, because this is funded care, is for those who are able to support us to provide surgery for these children to come and partner with us, just as NFDK has done. The awareness is not enough. That is actually one of our greatest missions, to create awareness, because knowledge is power. And many times we realize that even when someone has a child with a deformity, they may not even know that this is correctable. They may not know that this is not something the child has to live with. So just creating awareness, I would encourage every parent to take your child to a health center, a hospital, where at least a full diagnosis can be made and they can be told, is this correctable? If it's not corrected, how can we support the child so they can reach their maximum potential?